Dos Ani Bajo, welcome to the Membership Cafe. Today's cafe is launching and running a program. Our first quarter hour, I would like to introduce our speaker, and we might possibly have a couple, and I'll do a little exchange with them, and then we'll open up for discussion. Sarah Bursach, hello.
Hi.
Tell us a little bit about who you are and where you're coming from.
Okay, so I am the executive director for NADA, and I am currently connecting with everybody from Croatia, which is where I'm spending sort of a sabbatical year, and we've been here for about a month. And but normally I sit in the NADA office with Tanea and Andrea. And I've been with NADA about 10 years, and I'm a social worker, and I have both launched and run a number of different programs. And so I can't say that I have extensive experience in the area, but I have perhaps enough that could be helpful. And I'm also curious to hear what other people have tried and what seems to work and where people are maybe hitting some roadblocks, because those definitely always come. Even with the best planning and the best intentions, sometimes unforeseen situations will come up that you have to sort of on the fly troubleshoot. And yeah, I guess I'm here today to share any experience that I have that could be useful for others and to learn what others are doing.
I see we have Victoria, Marianne, Lauren, Crystal, welcome. And then I'm not sure the names of the three others, but I'd like to say welcome. If you want to introduce yourself, that would be great.
Hi, I'd be happy to start.
I'm sorry, the 303 number?
My number, I'm Cindy Pillmore from Firestone, Colorado.
Welcome, Cindy.
Thank you.
Thank you. And the 616?
I'm Amy. Can you hear me okay?
Yes, we can hear you perfectly.
I'm Amy from Grand Rapids, Michigan.
Thank you, Amy. Welcome.
Thanks.
Okay, so I don't know if any of you have had a chance to ever download the NADA article. It's called Launching and Running a Program Resources, or you can order it from our NADA bookshop. It's a really useful resource.
Can you see that?
Awesome. Yes. Thank you.
Mm-hmm.
Okay.
I'm on the video now, but using my headphones, and I'm Linda, but I'm actually Amy. I'm on Linda's computer, I guess.
Oh.
That works.
Nice. Okay. So here it is, launching and running a program, how to get started or decide if you want to. And then this is the table of contents. It's actually this is one of our larger packets of articles. Everything here is really good. I can't say like, oh, read this one. They're all a little bit different. So you'd sort of want to, different ones would apply to your situation, perhaps maybe more directly than others. Tanea, would it be useful for me to kind of, how do you want to go through this?
Well, however you would like to talk about it, it would be great for me to hear you talk about it too.
Okay. Well, and I will be honest, I haven't necessarily read all of these, but I've read most of these.
I did too. I read Alex Brumbaugh's, I read Rachel Toomum's, I read Ruth Ackerman's.
Yeah.
And then I also read the first part where Michael, I read acupuncture. I read bits of acupuncture helps programs more than patients, because I thought that was great. One of the things that these articles, a lot of them do, is they talk about the obstacles as well as the Ruth's article. She actually started a program in Santa Barbara, and she talked about the obstacles with that, and I thought that was a really good read.
Yeah, I think this first one, acupuncture, the value of the nonverbal, is really short. It's 3 pages long, and I'll just kind of jump to each one as we. Which one is this? These are the NADA Ethics Pledge. Acupuncture, the value of the nonverbal. I mean, looking at this itself is not necessarily going to be so useful for us today, but just I'll keep this up here. It's a great description of how the Lincoln Recovery Center was structured and how the acupuncture component interacted with the other parts of the treatment milieu, and why it was so critical for it being nonverbal and in the way that it helped the rest of the services. So this is a handout that we often print for large events and conferences for people to kind of get a sense of what NADA is about. To the table of contents, just to see the snapshot of this. I really love this next article, the Kent Sussex Programs, A Case for Acupuncture Specialists. It's written in the mid-90s, I think either 94 or 95, by an acupuncturist who helped to bring NADA into the state of Delaware, and he himself is located in Maryland. He made such an obvious case for why it's more cost-effective, more clinically effective, better use of staff time and resources to have your own staff trained as AccuDetox specialists versus contracting and bringing in outside providers, whether they be acupuncturists or other kinds of providers. It's more valuable to have the program staff serve as the providers. And so he just did a comparison comparing contracted acupuncturists versus nurses of a particular program, a detox program in Delaware. It was, I think, useful in helping getting the Delaware NADA activity happening. And this happened way before there was even a practice act in the state. And NADA was really, really widespread in the state at that time. So we, in fact, cited that article in a very recent publication that came out several years ago, that again, we sort of made a case for behavioral health providers of a large variety being able to do the NADA protocol, and why is that something we want to advocate for. So anyways, that's that article, and it's a great one. The integration of acupuncture into existing chemical dependency programs is a talk that was given at an international meeting. There's Michael Smith, and Brian McKenna is a NADA trainer who's currently based in Texas, but lived abroad for quite some time, mostly in Hungary. And NADA is integrated quite a lot in different European institutions. It's really strongly integrated in Germany, for example. It's very much part of hospitals, both chemical dependency programs and psychiatric settings. Denmark is probably the most active country in Europe with NADA, maybe in the world. They have 12,000 active providers right now, whereas in the States we have about 2,000. A little over 2,000 members. We have probably more people doing NADA than we know about because they might not be members of NADA, but still, we're not at 12,000, I don't think.
Right.
Alex Brumbaugh and Ruth Ackerman were colleagues, and so you'll see both of their names in this packet. And Alex Brumbaugh is also the author of a book called Transformation and Recovery, how to integrate acupuncture into a chemical dependency treatment program. And it's sort of a blueprint for doing. I recommend that as kind of a textbook on the sort of how-to of this. And it was written in 94, so it's a bit dated, but a lot of this information really is not different from when he wrote it. The parts that might be different is like insurance and billing. That landscape has really changed in the last 20 years. And that might be a question that you're coming onto this call with is, how do I make this sustainable within our services? I do know that when Dr. Smith kind of created this, it was intended to be outside of the purview of insurance. The idea was not to try to make money or to cover services of a program from the acupuncture, but to have acupuncture be a foundational treatment to all the other services. And that is not always a reality that can happen in many programs. And so we certainly talk about insurance, and people do bill insurance in different ways for this, even though there's not an actual code for AccuDetox. That's not what none of these articles are going to be talking about insurance. I'm not going to talk about it too much more, but I did want to mention it, and perhaps that might come up in discussion later. There's so much that goes into trying to establish NADA in a setting, and there's many pieces involved in getting it started, and then there's another level of program maintenance or sustainability, and Alex Brumbaugh really touches a lot on that in his book. those are the kinds of things it's important to be thinking about when you want to introduce something, is how is this going to be viable? How is this going to stick around for a while? Some of those things are not necessarily in our control, but Ruth Ackerman's article is in line with this, and really how to connect NADA with existing services so that the success of utilizing of those services is enhanced for people and that they get more out of what's available.
Because she wanted to work with the homeless. And she talked to different people about not being a competition with other programs out there, but working with them, not competing with them. So I thought that was a really great piece, and in all the different people that she talked to in the Santa Barbara area to make a NADA program happen for the homeless.
That is such a beautiful thing to highlight, because I think that does happen. That sense of competition occur pretty easily. And it's so important to remember there's no reason to feel threatened by the presence of other people providing this at whatever level it might be that's happening. Rachel Toomim's article again is sort of similar in a way to David Mercier's article in the sense of touching on the importance of being able to train people who are not either physicians or licensed acupuncturists, but have a variety of different experience within the behavioral health field, and that within states that are allowing this, the practice and availability of NADA grows faster and is more accessible. That simply is the practice of what we have seen over and over again. I think that this "What is Acupuncture" might be a handout. It looks like a handout. Yeah. I mean, everything is sort of formatted to follow this 2-column thing, but I'm sure when this was actually made, it did not look like this at all. That's nice. And acupuncture helps programs more than patients is really an article that talks about this treatment being a very levelizing treatment. So it does not promote hierarchy. It promotes a kind of horizontal connection among a variety of different authority levels, clients and program managers and social workers and counselors, et cetera, that everybody sort of is together and kind of human first and walking through this journey of health and healing together. And so sometimes counselors and providers will sit in a group with clients together. And at times, programs can definitely find that threatening. And sometimes it's what causes programs to close their NADA services when it starts to feel like there's too much empowerment happening, too much health, too much healing is happening here, and people are feeling empowered to speak up or get better. So who knows? I haven't personally experienced a program closure, and maybe somebody on this call has and can share about that experience. But this can be a very healing process for programs and can heal some of those issues that come with a hierarchy and various power structures that exist inherently in our various helping institutions. Okay, so I'm going to close this share. This is available just so people know, if you're a member, which I think everybody on this call right now is, you can download this for free from our website as a member. You just have to be logged in and then go to the resources section and go into I think it's called articles, NADA articles.
Okay, so tell us a little bit, like how long you've been in Laramie for 4 years, 5 years?
I've been in Laramie for 7 years. I'm going to be in my 8th year in Laramie starting in January. In 2014, 2 years into living there, there was an opportunity to organize a training in Laramie, a NADA training, and Michael Smith came out for that training. And that was my first NADA training ever. So that was pretty special. And I really, as much as I can say I'm the executive director and I've been an ADS for 10 years, I didn't know what I was doing. I knew what I was doing, but I was petrified. And also having Michael Smith there made it certainly a different experience. And so it was really a special training. And what happened at that training is that we had 4 public clinics as part of our training. So we had our training was a Friday through Sunday time frame. We had 2 clinics on Saturday, 2 clinics on Sunday, and we opened them up to the public. We're able to do that under the Wyoming law, that we can treat anybody. And so for Laramie, I think a lot of people showed up over the weekend. We had about 35 people that came. Some people came more than once. And Mike kind of commented to me that he clearly could see that there is a need for this in this community. People are showing up. And so why not make this a regular thing, like these clinics? And what I should do is go stand up in front of the room and tell everybody, when is the next clinic going to be? And this was completely for me out of the blue. I did not expect to continue this beyond the training, but I did, and we got a list of names. And then in that week after the training, I researched a little bit and discovered that our fire station has a community room connected to the building that's open to the public for groups to use as long as your services are free. And so, and then my co-trainer, his name is Gary. Gary worked at a community mental health program that also let us use a room. And so we started a free community clinic using NADA on a Friday and a Saturday. So for 2 days a week, we did that for about a year. And basically, I would do trainings periodically and then use some of the income from my trainings to buy needles for these clinics. And because we were donating our time and the space was donated, that was our only expense. And that lasted for several years like that. And then we slowly, as more clinics happened, more people that went through our training were interested in opening a clinic. And so that has now grown to 5 days a week of free clinics in Laramie. And in the meantime, one of the attendees just started sending us a monthly donation. And so I still do trainings. But I don't necessarily have to portion off some of the income from those trainings to clinics. We now have a monthly donation that comes in, and that is really helpful. And it's not a lot, it's $100 a month. I mean, it is a lot, and it's also for running 5 days a week free clinics. It's actually, I think, really affordable. And I would say they cost us about 11. We basically break even every year. So it's around $1,100, $1,200 that it costs us to do that. Now, that's not just supplies. Some years we've used that money for scholarships for people who are applying for their license as an AccuDetox specialist in Wyoming, which costs $80 for a year, the initial one, and then a $50 annual renewal. So sometimes we have undergraduate students who are ADSs, and they definitely need help to get their license. So we've sponsored them and a couple of other folks. So that's some of the other fees that uses up that donation money. And then since then, a couple of other clinics around the state have opened. So there's now a weekly stress relief clinic in Casper, which is in the middle of the state. And then another one associated with the public health department in Pinedale, which is way up right by Jackson, Wyoming. So that's been sort of a unique model of using NADA. It's in a preventative fashion, much more so than a treatment fashion. And people kind of refer themselves to the clinic, and we're not following anybody because they're totally anonymous. People do fill out a consent form, but they're not considered our clients. And we did a survey earlier this year and learned that although it's not specifically being applied as an adjunct treatment with other services, that people are using it in that way most of the time. And they're adding themselves, either get counseling or medical help or engaging in social activities. So we were really glad to see that it was being utilized that way, and we thought it was, but it was confirmed by doing that sort of little study of our clinics statewide. What that led to, the Laramie Clinic being there, was the possibility of getting something started at our local county jail. And my co-trainer, Gary, who I mentioned earlier, for 18 years now has run a kind of therapeutic weekly check-in group with both male and female inmates at the jail. He had established a long-standing relationship with that facility, and then I became a co-facilitator with him for several years of that group. NADA was not a part of this at all. This was just a talk therapy group, verbal group. And then what we did is I mustered the courage, because I really just didn't think that they would hear us at all about doing NADA in the jail. And then I just had a serendipitous conversation with a person who had been former sheriff actually in Laramie like 30 years ago. And I mentioned to him this interest that I had in doing NADA at the jail, but I didn't know how to approach them and what should I do. And I feel like I basically have like one shot and then it's done. And he just said, oh, we'll just write them a letter. They're really nice guys. And that really sort of normalized it for me and made me feel like, okay, this isn't scary. I can just do this and take a risk, whatever. What they can say is no. But 2 days after I hand-delivered the letter to the sheriff's department and also to the jail on like a Friday, and on Monday I had an email that said, we got your letter, we'd be very interested in talking to you and Gary. And I was just floored. I couldn't believe it. So anyways, we had a meeting with them and we ended up giving the sheriff a treatment and the director of the jail a treatment, and it was only 10 minutes, really brief. And after that 10-minute treatment, the sheriff said, wow, I could have used this like an hour ago. And then he shared about how he had read something in the paper and somebody had misquoted him and he was furious. And and I think the director of the jail didn't say much, but, he kind of nodded and said, wow, man, there's something to this. That was in December of 2017, and in January of 2019, they said, okay, let's meet. So for a whole year, a lot of back and forth, not a whole lot of interaction, but I would just periodically send an email to say, how are things going, And the reason they kept giving me for not starting sooner is they needed to hire more deputies. They didn't have enough staff. And finally, it seemed like they had enough staff and were just ready to go. And then it sort of almost shifted to where they had so much trust with us, they just said, well, how do you guys want to do this? And when do you want to start? And I was like, okay, well, how about February? And it was just almost funny and bizarre to me a little bit, but it was this like threshold that needed to get crossed. And then they really had a lot of trust in us. I used some forms that I got from a jail program in Maryland and just sort of adjusted them for the jail here in Laramie. We, have paperwork that tracks the needles, how many go in, how many come out. We have a document that tracks how many needles are brought into the jail, and then they let us keep our supplies there in a cabinet. We have a form that we give out to participants that just gives them information about the NADA protocol. We have an orientation sheet anytime that there's somebody new. The rules are reviewed, and this is all in relation to having needles out and about and making sure that they're always accounted for. So we've now been doing this since February of last year, and so far we haven't had any incidents. We haven't had to, shut down a group or had anybody steal a needle or anything like that. And that usually hasn't happened even in other jail-based NADA programs because the participants value the service too much to sabotage it. So we're struggling a little bit with staffing. Gary is currently our only male provider of NADA in Laramie. And so there's no backup for him. If he's sick or he can't go or something comes up, then the group just gets canceled. So I've now put the question to the jail personnel if there's anybody within the jail system that would be available to be trained, or would they allow 2 female providers to needle? That's a violation of their rule that you have to have a male and female pair. So we'll see. At this point, I don't know what happened, but we went from 2 days a week to 1 day a week, and hopefully we can go back to 2 days a week, but it might be a little while. We might have to get some more people trained. Yes, there was a question, maybe?
I have one. Do you get compensated for the jail time?
No.
You don't bill the state or anything?
No, I don't actually know how I would do that, but I'm doing it sort of as a outreach activity for NADA. Mm-hmm. So right now, all of our time has been donated and volunteered. We just wrote a grant in June to have the service covered and for Gary's time to be covered. And I actually really don't go into the groups at all. I started them and then I coordinate them and I make sure they have supplies. And then our student interns were going for a while. And then there's another woman who is getting her counseling hours. And so she goes. So that works. But then we need somebody who's kind of there leading it, who's Gary. And so I was trying to get him compensated, but we just found out last Friday that we did not get that grant. So I really hope that the city will actually, that we might be able to apply with the city or something like that, or perhaps the detention center itself has funds. But when the first thing they told us is, if this is going to cost us money, we can't talk about it. And we said, okay, well, this is not going to cost you any money. And we figured out how to make that work. And then we had the pilot program. And what's starting to happen now is that the sheriff is talking about this service with other programs in the city, in particular the drug court program and also public health. And they're now calling us saying, oh, we want to have our staff trained. We've heard about this and that it's working really well. So it's having this ripple effect in the community, which is really outstanding. And I actually didn't expect that to happen. So, I think of the jail as a very closed system, but in a small town, the sheriff is very connected with a lot of different services. And it might be who he is or his role, I don't really know, but, he's on the suicide prevention task force. He shows up to emergency response meetings at the hospital. He's active. He's active in the community. And so it's cool. And he wrote a really great letter of support for the grant that he gave us permission to share. So if for some reason somebody here is interested in working in a kind of correction setting and needs, a stamp of approval from someone in a similar setting, let me know, and I'd be happy to share that.
I just received an email this morning from the Albany County Court Supervised Treatment Program. I asked her to contact Gary in regards to doing a training, and so she emailed me to let me know she emailed him. So that's kind of exciting.
Yeah, that's really.
Yeah, we're going to open up for any discussions or any questions or concerns or anything about. If you have any questions for Victoria Taylor is a registered trainer. Hi, Victoria.
Hi. I have another question for Sarah about the program in Laramie, the confidential program. Do people sign a consent form every time, or do they say, I have one on file?
They say that I've done it before. Yeah.
And how do you know? You don't mark that?
No.
Okay. Because we just started a program very similar to that in Roanoke. We're calling it the Timeout Lounge. We've been trying to figure out if somebody wants to tell probation and parole that they've been going, but we want to have it completely confidential. So what we've been doing is having them initial an attendance card.
Oh, sure. Yeah, that works. The different clinics around the state actually kind of do it differently. There's a clinic, the Casper Clinic, for example, it laminates the consent form and then it has a sign-in sheet. And so every time that people come in, they could look at the consent form and then they just initial that they were there.
Right.
But then they don't have an original consent form that someone signed at the first time.
So they have it by time, not by person.
Yes, by group. So in each group, essentially, they're giving their consent each time because the consent form is present, but they don't have an original signed consent form from that person at their first visit.
Right.
We have one consent form from that person's first visit, and then we keep that on file. Yeah.
Right. But no attendance records after that. Right.
Yeah, we are most likely going to start attendance records. We've done this for 5 years and there's not been an issue. I don't even know whether I say this is a good idea or a bad idea. I know that probably every NADA trainer would scowl at me and tell me this is a really bad idea. But it keeps it so light. People walk and then they go, and it feels really nice in that way. But it's not that big of a deal for someone to just initial. We've had all kinds of conversations. We actually made a little nonprofit for the Wyoming Stress Relief Clinics, distinct from NADA, because they're really a different To talk about, do we want to universalize our paperwork, or does each clinic have its own system? And the only reason why we might universalize is if we decide that we're going to apply to the federal government for liability coverage as free medical clinics.
Oh.
That's available. It's called the Federal Tort Claims Act, and you can be covered as a free clinic. You can take donations. That's still considered a free medical clinic, but you have to have a medical record. And so I was in discussion with them what constitutes a medical record. They said, well, there's no other clinic like you, so you're kind of an interesting, unique situation, but we're happy to work with you, and you should definitely apply.
Well, it's not true that there's no other clinic like you, just none that have asked for insurance.
Maybe not have talked to them. Right. I'm not saying that's right. That have reached out to them to get that federal coverage. So I haven't gone through that application process, and so I can't really speak on whether it's challenging or not. It doesn't really seem too onerous, but I don't know. What would be nice is that it could cover people like students who are not professionally affiliated yet, and they can take out insurance as students, but it would be useful if they wouldn't have to. So.
Thank you.
Are there any, it would be great in a way
Pam,
to hear what other people are doing, if people are doing programs or trying to start things up.
That would be great. I kind of want to talk too about, that's one specific kind of program. There's obviously a lot of different ways
Definitely.
that NADA is provided. We do have support for people who are looking to start, like if you need a presentation or something like that, those resources are on the website under member resources, right? We have PowerPoint presentations available for people. I would like to hear from some other people about if you're looking to start a program, or if you work in a hospital setting, or, are you having any obstacles?
Don't all talk at once, please.
Well, I think that the people that I train, their biggest problem is there's all kinds of people who want NADA, but the ADSs want to get paid. Like to go Saturday to the Peer Recovery Lounge, and we've been doing that on a volunteer basis, but people are only willing to do it once a month because they don't want to pay for it. And then the Time Out Lounge we have every week, but it's in a different city, but it's volunteer, and we're trying to keep some statistics and get grant money to pay for that through our city.
Smart.
That I would say that the people who work in inpatient hospital, they get paid a salary anyway. So if an hour of it is NADA or not, and that's in Flint. But it's these other more creative programs. How much of your time do you want to be volunteering your profession?
Yeah, that's a good question. Has anybody else encountered that as either a barrier or an experience that you've had?
Hello?
Yeah.
Hi.
Yes.
Hi, I'm Lolita, and I'm in Baltimore. There have been several community-based drug programs that I have approached, and to do the NADA protocol. The question always comes up is, how can we pay you? Because I always feel like, what I feel like is that while they do know the benefits of the NADA protocol, because it's been around in Baltimore City for a number of years, they have not, when they created their programs, they never really factored in that it's a component to their program. When I'm coming in and asking them about I would like to join, be included, I've had them ask me do you know if it's covered by Medicare or Medicaid? And that virtually really shuts down the argument or the discussion really, because if you're creating a program, a substance abuse program, but you didn't take this particular protocol into context when you first started the program, it's kind of challenging to bring it in, and that person does want to be paid. I don't know why acupuncturists, we spend so much money going to school and all this other stuff. We have bills to pay. So I can understand why people they have limited volunteer hours because they still have to pay their bills. But why as a profession, I know we are very altruistic and we want to go and help the world and help people out and stuff. Why aren't we being looked at as a group of people, as a profession that should be paid? And I guess it may be more of a comment than a question.
Right. That's okay. Comments are good, and I think there are a lot of programs that are paying and contracting acupuncturists and other NADA providers to come in and provide services. They, I think, are typically more in sort of larger institution settings, hospitals or programs, depending in states where they couldn't train their own staff necessarily, and so they're contracting acupuncturists to come in and do that. I think there's a mix. I mean, I think there's a mix of people who are volunteering and people who are getting compensated for the service.
Well, thank you for your comment.
Are you currently providing NADA somewhere, or it sounds like you are an acupuncturist as well? Is that right?
Yes, I am. But yeah, I used to provide NADA services at University of Maryland Medical Center. They cut us out because they didn't really have a dedicated budget for us acupuncturists. We were a part of like the general fund. So when things were happening in Washington with insurance billing and Medicaid and Medicare, the hospital budget started to get more squeezed. And as a result, eventually our department was closed. I also used to work in the jail in the Baltimore City jail, work under someone who had the contract. And that got terminated as well. Oh, not really terminated, didn't get renewed. And I had been working with this gentleman in the jail setting for like 15 years.
Oh, wow.
But it didn't get renewed. And since then, I've talked to a few other people that have run community-based substance abuse programs. The topic always comes up about how can we pay you, or how can they, for my time and my services, or not only just that, like, for them even just to buy the supplies, even if I would offer my services at a rock bottom cheap price. Oftentimes there is like no ability, no wiggle room to even include a new modality into their services. While I do agree with you that there is not a protocol being practiced in various settings, whether it's hospitals or other drug treatment programs, there could be more.
Definitely.
Absolutely.
And because it offers a very valuable treatment. For a case of point in the jail, we were doing ear seeds, particularly for the guys who did not want to get the 5 needle points done. We were offering them ear seeds. And one of the biggest things they loved about it is because it helped them to be more calm. It helped them to sleep better. It just helped them to relax in general. So when we because of it wasn't written explicitly into the contract, we had to stop using it. And the first thing that I heard from the guys in the weeks that followed was, wow, we miss it. This is how it helped me. And with my sleep, with my temperament, with me being more, stressless. So, it's every aspect of what we provide is important, and I'm glad you're having this discussion because it's getting me to thinking more about how I can do something on my own, even if it is me giving up my time to volunteer to do something. It's just needed, particularly in this city because there's just so much stuff going on.
I'll tell you one thing a group near me did is they had an open clinic in the same place as the AA meeting was. There before or after the AA meeting wasn't affiliated. It was just in the same, public space. And they had a donations box, and they used the donations box to train more people so that you didn't have to volunteer so often. That was just a creative solution.
That's pretty cool.
Yeah, that is a great creative solution.
I think a photo that someone sent us was a picture of an offering. It looked like a tip jar, but they called it a basket or something like that. And somebody left some strawberries. I thought that was great. Okay, so we're at the bottom of the hour right now. This time is a time for discussion on anything else, or if anyone has an announcement. One thing I would like to ask is, I guess I'm kind of going to go back to the conversation, but when things like that happen, like, oh, it's not written in a contract, or is there anything that the NADA organization can do to help situations like that, do you think? What do you think, Sarah? Do we have any committee that can reach out and say, hey, we need support for right, figuring out how we can get beads and seeds into this facility.
That is such a great question. I would say probably the grassroots outreach committee is maybe the closest connection to that, but it's not necessarily really geared towards troubleshooting.
Mhm.
The grassroots outreach committee is just a platform that people use to share the kinds of activities they're involved in, and it's sort of a time where it's a lot of different updates, you know, from people all across the country. So it's really motivating and it's really exciting to hear what people are doing, and perhaps it could give somebody an idea to try something if they have run into an issue. I haven't heard people so much use that space though for getting that kind of help, but I think that if there's an interest for that, we could certainly look into starting I'm more of like a how-to committee, helping people with just a forum, even, sort of like a informal support group with NADA at the table. And if there's something that we can do, we certainly will. I mean, sometimes we've had conversations with program directors, or we've written a letter of support, or
Right,
things like that. And we could always do that. Or we can maybe send a board member who could be nearby to go and advocate for a situation or meet with somebody. Those are all possibilities. Really specifically have any kind of technical assistance program set up. We have a really strong network, and that's how we usually resolve a lot of things, or at least try to help people feel more supported and give them information that they can access resources that they might be needing.
Thank you, Sarah. I appreciate that.
Yeah.
Cindy in Firestone, and I just wondered about whether, and you may already have this, I haven't really checked your resources very thoroughly, but if there's kind of a universal contract form that just would at least supply some of the wording around some of these issues that people could have as kind of something to refer to when they're working out their own contracts.
You know, what I typically do is ask people to share their contracts, or mostly what we have are policies and procedures that we do have in the members' resources. And we have, I think, 4 different sample copies. I wouldn't say we have a contract exactly, but in terms of when you have a program actually in place, what documentation would you need to have the program, recognize it. But I will see if anybody here has a contract that they would like to share with us. What we normally do is just use templates that other people have used.
Sure.
And post that on there. So that's a great idea.
Well, it's helpful to be able to just look at something that's already been done.
Right, so you're not like recreating something.
Always. And I just wanted to say that I've really enjoyed being a part of listening anyway today to the discussion. I have only been certified in NADA since March, and my training was a year before that. So I've been moving kind of slowly because there have been a number of other life things happening. And I'm now just considering approaching the administration for a little program, a little residential program called Choice House in Boulder for NADA, because that's not currently being offered there. And certainly there are people and various programs in our area, because I think Boulder, a lot of people are informed, around the recovery community and see it as a really positive adjunctive therapy. So I'm looking at my own kind of starting to step out and just feeling my way into it a little bit. So this is very timely for me. And
oh, good. That's exciting.
Yeah. So I'm a newbie in terms of offering NADA in a very public way, but not in terms of working in the recovery field. I've been doing that for many years and have been kind of partially retired now for a couple of years. So yeah, it's like, how much of my big toe do I want to put in the water, really? But taking a look at it. So anyway, thank you.
Yeah.
Well, thank you for coming and attending. Sorry, Sarah, go ahead.
You bet.
No, it's okay. I know you breathe in. I breathe in, and you're so attuned. I wanted to just note one thing that I learned in terms of sustainability of NADA services is that you eventually do not want to be the only provider in a program.
Nope.
As soon as things kind of take hold, and if you feel like there is receptivity to it, you want to see, okay, are there resources somewhere so that more people who are here or that they could bring in could be trained so that if you get sick or something happens, that things don't just either temporarily stop or just kind of fall apart?
Right, right.
We see that a lot, that, you know, people retire or they just leave a job and then all of a sudden the NADA program is no longer there.
Right, right. I've definitely been aware of that kind of change. And I did think the earlier discussion about payment or donation and sustainability, how do people feel that they're at least having some exchange, even if it's just enough to cover supplies? Those are important elements for sustainability for folks.
Mm-hmm.
And so all of that's, you know, in the mix to consider.
It certainly is, yeah.
All right. Thank you, everyone, for sharing. Is there any announcements or any suggestions or comments before we wrap up?
Just to say thank you.
Oh,
Thank you, Marianne.
Yeah, it's the first time I've used Zoom, so I don't actually know how it works well, but I appreciated listening.
that's awesome. Good job doing something different and taking a risk, because, you know, it can be a little frustrating. You know, it makes you download something and that always makes us nervous. Is this okay to download or not? And, you know, so we appreciate that you guys made it happen to come on. I wanted to just share one announcement that Lolita, I think, am I saying your name right? From Baltimore.
Yeah.
Reminded me, I wanted just to for you specifically, but for everybody else on the call to know, is that we are going to have our national meeting and conference in Baltimore in 2021. Yeah, I'm very excited. We're looking at locations right now, so it might not be exactly in Baltimore. We might be at like a college campus of one kind or another. So we are going to keep the community posted when we actually have a location set, but it will be in the vicinity between Baltimore and DC. That is for certain. And then our pre-conference trainings will be, we may have multiple, and so there will definitely be some at Penn North in Baltimore, in the city of Baltimore, and some other programs using NADA, and perhaps also again at a college. So anyways,
Okay.
posted, yes. And then we also have 2 regional meetings that we are about to announce with our next issue of Guide Points that we just finished yesterday. Woohoo! So we have 2 regional meetings in the U.S. and we're still trying to nail down a Canadian one. But in the U.S., we're having a meeting in Arizona, in Phoenix, April 18th, and then in Detroit in June 13th. And these are one-day meetings. They're a bit smaller than our national conference, but the idea is to try to have more than one meeting in a year so that people could potentially attend who are, you know, either locally or regionally connected with the location, or, you know, that there's more opportunities to go to a meeting. And then the third one, we're looking at Toronto and around Toronto sometime in the fall of 2020. So just to have that on your radar.
Oh, that's good news.
Yes, agreed.
Awesome. All right.
Well, thank you to all of you. This is like our most well-attended call, so clearly this is an important topic.
Yay.
Yeah. And if you have any more questions, feel free to give us a call or email Sarah, who's in Croatia.
Yeah, I'm still working.
Yeah.
Multiple offices. I'm at nadaoffice@acudetox.com. Thanks, guys.
Well, thank you for attending.
Okay.
Everybody. And our next membership cafe will be October 16th. And we will be celebrating Mike Smith's birthday, so I hope many of you can attend as well. And we'd love to hear from you again in October. So thank you for coming on today.
Thank you.
Yeah, if you want, we record these and I usually edit them out and send them out. So if you would like a recording of this to go back over again, you can always email me at membership@acudetox.com and I will get a copy of this to you as soon as I'm done editing it.
Thank you.
Okay.
Thank you.
Uh-huh.
Have a great day.
You too.
Bye.
Bye-bye.
Bye.
Bye.